15 days following his full knee replacement, Dr. Smith returned to UAMS for his first post-operative clinic visit.
But you're looking great, actually. Good. So you need to take...
Dr. Smith was experiencing a few complications. A bit of nausea caused by pain medication, post-operative surgical pain. According to Dr. Evans, this is typical discomfort during the healing process.
I certainly don't regret having it done. I have to admit that it's been a little bit more of a struggle.
Your incision looks good.
Thank you.
Okay?
He has not quite full motion, which we never get at 2 weeks. He has better motion than if he had had a full open surgery. He already has as much motion as some people get with a full open operation. He'll expect another 20 or 30 degrees of flexion and extension. He's already carrying his cane around at 2 weeks out. So he's flying. He's doing exactly what we want him to do. So.
5.5 weeks after surgery, Dr. Smith does indeed seem to be flying through his physical therapy sessions, an essential component for recovery and becoming familiar with the movement of a brand new knee.
Incisions heal nicely and no trace of any problem, infection or anything like that, so that looks good. Not bad, huh? I'm getting around pretty well on my own without any canes or crutches or aids or anything like that. Able to go up and down stairs, take walks, short walks, up to 15 to 20 minutes, I'd say, without any trouble. Good morning.
Good morning.
Less than 2 months after his surgery, Dr. Smith is back at work.
Yeah, want to see my scar?
Walking, oh my God.
There it is.
There it is. Oh, my knee is getting this.
8 weeks ago. Well, 8 weeks ago Thursday, yeah.
And you walking on that 8 weeks?
Yeah.
Ironically, his first patient is considering knee surgery with Dr. Richard Evans, a patient who has already had hip surgery.
So what's hurting you now?
It's my knee.
Your knee. Uh-oh.
Dr. Smith says his knee replacement has provided a bonus benefit in his practice. He can speak of the procedure with experience, and now, having been the patient, he has much more empathy for others who need the surgery.
And me, so she thought it was pretty miraculous that I was flying around here this morning. And she kind of got a big kick out of that, and so we had a good laugh about that.
Now, after initially being hesitant about having the surgery, finding out that he would require a full knee replacement, not the smaller, less invasive one, and enduring the expected pain and discomfort of recovery, has the knee replacement been worth it?
Yes. It's increasingly comfortable for me to say yes to that. It's just during the first few weeks, it's hard. You have to really swallow hard when you say that because it's really uncomfortable. And now that I'm over the worst of that, I can begin to see the benefits of it. From my perspective, all is well, and I would have to be considered a successful case. I mean, look at this. I mean, it was less than 2 months, and granted, that's a big 2 months. But then I've got, theoretically, the next 15 or 20 years, if I don't have any problems, that I can go, at least in that knee, and basically have a pain-free existence. That's a pretty good deal.